important for ladies of all ages to look after their pelvic floor, especially after they've had a baby. So tell me, what is pelvic health? Because it's quite a broad thing.
Yeah. So basically, a pelvic floor physio is going to treat anyone who might have an issue with their pelvic floor muscles or their pelvis itself. So things like urinary incontinence, fecal incontinence, urinary urgency, sexual dysfunction even, your pre and postnatal rehab, constipation, pelvic pain, the lot. So there's heaps and heaps of different things. Yeah.
Pelvis is a very important area.
Yeah.
So what are some of the common pelvic floor problems then? So you mentioned a few there, but obviously there's more to it. So is it like pain when you're having intercourse and things like that?
Yeah, so you can have like pain with intercourse. You have a lot of issues, I suppose, after you do have a baby, as you said, and that can be, just getting back to having intercourse. That's a really hard process for some people. But the things that come along with giving birth, like, prolapse of the pelvic organs, so it can be the bladder, the bowel, the uterus, incontinence, even getting back to exercise. So we do address all those things.
Especially if you've had a C-section.
Oh yeah, So
the tummy part and everything
like
that.
So like diastasis, so you bring that back together, get people using their cores again, because obviously like when you're pregnant, your abdominal muscles, they're going to stretch way beyond what they normally would, and so after that they don't just bounce back straight away.
No, I think it was I had that pelvic separation for a long time afterwards.
Yeah. So we help with all of that.
So how can physiotherapists help then after, looking after that pelvic floor?
Yeah, so I mean, a lot of what we do is education and a lot of guided exercise, but we might also look at doing some external or some internal release work. So particularly if you have like trigger points or tight bands through your pelvic floor muscles, we actually go internally, have a look at and feel those muscles and release them off. And sometimes that can make a huge difference to any pelvic pain that they might have. Even if it is, you think it's coming from your back or you think it's coming from your pelvis, it could be coming internally as well. So yeah, lots of things that people don't expect us to do, really.
That's incredible.
So you mentioned there's several different ways you examine a patient. So can you just talk to me a little bit more about that? Because the internal examination certainly got me thinking, how do you do that? Have we been poked and prodded enough after having a baby?
Pretty much, like it doesn't stop there. But basically, when you come in, it's an hour-long consultation. So, you come in, we'll ask a bunch of questions about your bladder, your bowel, your sexual function, because the pelvis is a really complex area. So all of those different things can affect each other. So you come in with like a bladder issue, you probably might have a bowel issue as well. So we can address anything that comes up there. And I think, as you said, what most people are really unprepared for is the internal examination. So
I didn't know physiotherapists did that.
Yeah, we certainly do, and like the learning process is great, but
you and Dr. Liz should hang out.
Pretty much, yeah. So yeah, we do an internal exam, and it's not like necessary like 100% of the time, because we do treat children and teenagers, so that's a group that we sort of try to avoid. But it really gives us a lot of information about what's going on with the pelvic floor muscles, where the pelvic organs are sitting, and from there we can look at things like muscle length, muscle strength, endurance and coordination, and particularly for pain patients, any trigger points or like tension through the muscle that we might need to release. So, it's not necessarily as easy as going, do these pelvic floor exercises, because everyone's different.
Yeah. So what are some of the ways that you treat patients then? Because there must be, once you've released, so for that internal one, you've released that muscle to try and fix it, but what are the sort of exercises that women get to do?
Well, they can do their regular exercises, which is just stock standard, but we can also employ things like Luna beads by Lilo. That's the brand specifically that I use, but you can use any type of vaginal weight. And I specifically use them quite often for runners or people who want to go to the gym and are getting leakage at the gym. And that's really important to get those women to be able to feel like they can exercise without feeling like they're going to wet themselves. But they can learn how to pop them in and do their functional everyday tasks with them, and then gradually the pelvic floor will learn to hold on while they're doing all those functional tasks.
So it's like weights for your vagina.
It really is, 100%.
So if you're looking to learn how to take care of your pelvic floor, speak to a professional and get the best advice and exercises for you to help that pelvic floor. The team at Cairns Pelvic Health Clinic can certainly help you.